The CSO Partnership for Development Effectiveness is an open platform that unites CSOs from around the world on the issue of effective development cooperation. Effective development cooperation is a framework in achieving real inclusive development by ensuring an enabling environment for all development stakeholders. It puts forward development that upholds human rights, decent work, gender equality, environmental sustainability, among others. CPDE strives to make development more effective by reshaping how global aid is done and empowering CSOs to play a large role in development work.
CPDE hopes to be able to address the issues of human rights, people's rights, people's participation in governance, in decision making, in democracy. And we hope to achieve this by collaboration, cooperation, or solidarity with different stakeholders and actors like government and certain private sectors.
CPDE brings together CSOs to work in various advocacy arenas. For many years, civil society has been pushing for genuine solutions to address worsening poverty and inequality. These efforts have resulted in the formulation of commitments and principles of effective development cooperation in 2012. Since then, the CPDE has promoted the EDC. One of the main goals of CPDE is to universalize EDC, which means applying the framework to all development programs to ensure that the symptoms and structural causes of poverty and inequality are addressed.
La cooperación eficaz es importante porque en general mucha cooperación viene por parte de los gobiernos. Sin embargo, para que esa cooperación sea transversal y sea participativa y democrática, la sociedad civil no solo tiene que estar en el momento del diseño de la cooperación, sino también en el momento de la implementación, en el momento del monitoreo, para poder hacer lo que llamamos apropiación democrática. Y es que las sociedades que reciben esa cooperación se sientan parte, involucradas con los procesos de cooperación y que realmente sea sustentable, es decir, que a largo plazo esas sociedades puedan subsistir y puedan desarrollarse, desarrollar su industria, desarrollar su sociedad, desarrollar sus derechos sin la necesidad de una cooperación internacional.
CPDE members are located in 117 countries across 7 regions. CPDE convenes 8 major sectors: agriculture and rural development, feminist groups, faith-based organizations, indigenous peoples, international civil society, labor, migrants in diaspora, youth.
Over the past 10 years, we have seen that civil society organizations Their trade unions, women's organizations, youth organizations, farmers organizations are increasingly being oppressed by governments and vested interests. And our biggest achievement is to consistently bring this issue into discussions about development aid and development effectiveness.
Join us, and together, let us embark on the journey towards effective development cooperation. To know more about our work, visit our website at www.csopartnership.org and follow our social media accounts.
Hang on. Hello? Hello, everybody? Hello? No, I don't think it's connected.
Oh my God, I'm coming.
Yeah,
Sorry, Mike.
there should be someone in this room. There should be someone here. Hello?
Hello, Dr. Ryan, can you hear me?
Hi, yes, can you hear me?
Yes, this is Justin Kilcullen here, the moderator of the session. Just checking
Hi,
that
Justin.
everything's
How are
okay
you?
with you.
Yeah, I think we're okay now. I think we had an audio problem there for a minute, but I think we're fine.
Okay, I'll hand back to the technical people who will just give us a brief introduction to how we will be able to conduct the webinar. Many thanks for being with us, Michael.
Okay.
Thank you so much, Justin, and welcome to all. So to officially start our program, good morning, good afternoon, and good evening to us all. My name is Sarah Torres of the CPDE Asia Secretariat, and I will be your host. So welcome to our global webinar of the CSO Partnership for Development Effectiveness, an open platform that unites civil society organizations around the world on issues of effective development cooperation. So our event today is titled World in Lockdown, Development on Hold, a civil society assessment of the ineffectiveness of COVID-19 response. And we are very glad to see all of you. And right now we have as many as 80 plus participants. And of course, there's more watching via our Facebook Live. So thank you so much for coming. We have a full program ahead of us, and we are happy to be joined by speakers who are doing important work in the COVID-19 response. But first, here are some reminders for all of us to ensure that we will have an orderly and productive webinar. So first, please rename yourself using this format, name-organization. So in my case, it's Sarah Torres, -ROA AP, and CPDE Asia. Second, our webinar is available in French and Spanish. So for participants who need interpretation, please click the interpretation feature and go to your respective channel, then click mute original audio. So this is important so that we don't overlap the interpretation. I'm going to be able to see the translated version of the PowerPoint presentation. Just click View Options on top of the Zoom interface, and then click your Decide Presentation, which is also available in English, in French, or in Spanish. Third, participants will be muted throughout the webinar. And so participants will only be able to unmute when called upon. The host will send a notice asking the participant to unmute. Fourth, if you have any question, just click on participants and then the raise hand button. Fifth, you can send a message to the host and co-hosts if you have any comments, and we will relay it to everyone as the time permits. And number 6, for all English speakers, this is also important. Please make sure to go on the English channel again, so we so the interpretation does not overlap. All right, so those are our 6 reminders. And at this point, I will turn you over to CPDE Co-Chair Justin Kilcullen, who will be our moderator. So over to you, Justin.
Thank you very much, Sarah, and I hope everybody got all of that. So good day and welcome to you. Just a brief introduction. As the COVID-19 pandemic took hold this time last year and began to spread globally, we in the Civil Society Partnership for Development Effectiveness became concerned at the manner in which many governments were dealing with the growing crisis. As a constituent part of the Global Partnership for Effective Development Cooperation, we wondered how the pandemic would impact on development programs. In particular, how would the principles that underpin development effectiveness, including accountability, country ownership, and inclusive partnerships, with a particular focus on a human rights-based approach, and the SDG objective to leave no one behind, how would these be applied in countering the pandemic? Given the early experiences in many countries, we decided we could make our own distinct contribution to the global effort by carrying out research on these issues at country level and bringing to the attention of the global partnership and beyond our findings. And the launch of our report from this research is the context of today's webinar, entitled The World in Lockdown, Development on Hold, the Effectiveness of Development Cooperation in the Time of the COVID-19 Pandemic. So following our opening session with Dr. Mike Grind of the WHO, we will have a presentation of the main findings of the research illustrated by a case study. We will then have further inputs from a panel of distinguished speakers representing different donors and stakeholders in the development effectiveness agenda. And there will be a number of opportunities for you, the participants, to ask questions and offer comments throughout the programme. And finally, we will have a short formal launch of the report to end the webinar. So many thanks to you all for joining us today. I see we're nearly up at the 100 figure now, and we hope you will find it a rewarding experience. Now, we are greatly honoured to have with us today Dr. Mike Ryan, who is Executive Director of the World Health Organization's Health Emergencies Programme, and he leads the team responsible for the international containment and treatment of COVID-19. Dr. Ryan, you are really most welcome. We understand the pressure that you are under in your job and that your time is precious. And we are just most appreciative that you have agreed to come with us today and to enter into a dialogue with those of us here for our opening session so that we can hear your experiences and hear your views, and you indeed can hear our concerns. Just to introduce Dr. Ryan a little more formally, he is from the west of Ireland and trained in medicine at the National University of Ireland in Galway. He's a Master's of Public Health from University College Dublin, and he completed his specialist training in communicable disease at the Health Protection Agency in London. He has had leadership positions in various outbreak response teams in the field to eradicate the spread of diseases, including cholera, the Crimean Congo hemorrhagic fever, Ebola, meningitis, and SARS. A man of great experience who has become a leader in today's world in coping with this crisis. And typical of a man of action, he's not interested in making speeches. He wants to get stuck in immediately to meeting with you and hearing from you. So this is a question and answer session, and I will ask the opening question, and we'll then open it up to the floor when Dr. Ryan has answered. So, Dr. Ryan, speaking at the UN Human Rights Council in April last year on the issue of COVID-19, the UN Secretary General Guterres said, and I quote, "A human rights lens puts everyone in the picture and ensures nobody is left behind." And we want to ask you today, as you observe the response of governments across the globe to the pandemic, how well do you think they are applying a human rights lens to their efforts? You're welcome, Dr. Mike.
Thank you, and thank you for the invitation to join. Yeah, no, I think everyone is trying to apply a human rights lens, but unfortunately, on key matters of equity, I'm really sorry to say that a lot of communities right now are in the rear view mirror and not being observed through the lens of equity and human rights. And I'm disappointed to report that, but this pandemic is uneven around the world. It's uneven in its impacts. I've said before that it's been a great revealer. It's peeled away old wounds, the bandages from old wounds in our society, and it's also revealed and driven new inequities. So we're not doing a really, really good job at ensuring that the basic human rights are being upheld. The right to health, the right to have access to health, the right to personal dignity, and in some cases, COVID-19 has been actually utilized as a means of denying people their rights. So I don't mean to be a pessimist. I think we've seen some great examples of community resilience. We've seen wonderful examples of people and communities and organizations, the civil society and other organizations coming together to fight this pandemic together. We've seen that kind of solidarity right the way through the system. But if you are giving grades for how we're actually doing in terms of leaving no one behind, I think right now we get an F.
Well, that's putting it pretty much clearly. Is there a follow-up question from the floor to Dr. Ryan's opening answer?
Maybe I've shocked people too much with my comment.
I'm not sure how we're getting the questions through here. Poti, do we have a question? Luca de Freya. Luca? Luca, your question?
Yes, the microphone is on. So thank you so much, Dr. Ryan, for your very clear response. And I would say this is very much in line with what we are witnessing in our work. And if I think about the next few weeks, for instance, we're going to have important key moments at UN level, for instance, on financing for development. So my question for you is rather, if I may ask you about advice that you may have for us CSOs, operators, in which way we should be going to make sure that this inequality is properly addressed. In our conversations, we were talking about a pandemic of inequality. Do you think that there's a preferred way to address this in the current situation? So thank you so much for advice.
Yeah, that's a good question, and you're right to put it back on me. These aren't easy to address. As my grandfather used to say, it's almost like closing the gate after the horse has bolted. You know, addressing endemic inequity that's already in place would have been much easier to avoid it in the first place. You know, we failed to prepare for this pandemic, and we failed to invest in community resilience. We failed to invest in the surveillance systems, the production systems, the technology transfer, and all the other things. We knew a pandemic was coming, and we really have been caught in the headlights of that pandemic. And it's taken us, 16 months in. We're still struggling to deal with the tragedy of it, and still struggling to come up with a comprehensive and coherent response at every level, at community level, at national and at global level, across many of the issues that matter in terms of human rights. We've seen health systems disrupted beyond the images of the ICUs, but tuberculosis services, HIV services, immunization, health services for women and girls. We've seen a rise in gender-based violence. We've seen hunger emerge in places we never thought we would see as a risk. And communities and individuals are facing risks and concerns that go well beyond COVID. The risk of my COVID, yes, but the risk of my job, the risk to my mental health, the risk to my future, the risk to my children's education, and many of these other things. And I think what we've witnessed is an absence of societal cohesion and societal investment and societal fairness that goes back decades and decades. This is not a civilization that is ready to deal with a universal pandemic or emergency of any kind. I've just come out of another talk. We were talking about pandemics. Pandemos means what it says. Pan, from the Greek, all people. Pan is all, and demos is people. All pandemic means is all people. That's the direct translation. And it has delivered on that. And working our way out of this is not easy, because there are deep inequities that are there, built into the system, hardwired, and we can't deal with those directly right now. We need to remember them, and we better not forget. But if we're going to work our way out of this right now, and we want to look at how we get back or not get back, I don't want to go back. I'd rather go forward to something a little bit more compassionate, a little bit more fair, more inclusive, with more humanity and solidarity at the center. That's a dream. But right now, if we want to look at with all of those inequities in mind, the single greatest inequity in the coming weeks is going to be that older, more vulnerable people with underlying conditions and health workers are going to continue to die in countries that do not have access to vaccine. As we roll out vaccines in their hundreds of millions to perfectly healthy adults in mainly industrialized countries. We have got to fix that. We have simply got to fix that, or we have no right to try and fix the other things. And we have no mandate to fix those other things. And the world should wake up to that reality. We're about to preside over a massive global injustice. And we need to consider that. And if I would say is there's one thing we could do as a symbol to the future, if there's one thing that would give us all the right to speak about inequity in 6 weeks' time or 6 months' time or 6 years' time, is that we work together to fix that today. Not tomorrow, not next month, and not next year, but today. Because in all conscience, to look out on a world where this is now occurring before our very eyes is very hard to take. Over.
Thanks.
Jennifer Malonzo, would you like to ask your question? You need to unmute.
All right. Thank you. Good evening, Dr. Ryan from the Philippines. I'm Jennifer Malonzo from Ibon International. I truly share your thoughts and what you have highlighted about inequity. So we are here, over a year has passed, and countries like the Philippines, we are back in lockdown. We have ever-rising cases with limited vaccines, and our economy is deeper in debt with COVID-related loans, and yet these are not felt by the people on the ground. So the most burdened and at risk are, of course, the marginalized groups and communities. Well, as you've said, healthcare systems are really severely limited. And this is a product of years of government neglect in investing in public health, and also the years of privatization that has, really commercialized health systems in countries like ours. So what would it take, Dr. Ryan, to have any policy change arising from this pandemic experience, which, as you said, may well be with us for years? Do you think the people's right to health and development will ever take center stage, or will, the business as usual, the profit-driven agenda still prevail?
Thanks, Jennifer, and thanks for your perspectives from the Philippines. And I can see in the data just how difficult it is there right now. No, and your question is fundamentally important. And if we just look at the health system as a whole, and we look at how health systems are connected globally, clearly a good deal of this, the impact of this pandemic has been avoidable. We've seen countries that have done very well in containing and controlling the worst impacts of this disease, who focused on community-based interventions, who had invested previously in strong public health architecture, who were able to quickly expand their testing and tracing, who could give supported quarantine to individuals who had to quarantine. And there are a number of countries around the world who today are having rock concerts and having large-scale gathering events who've weathered the worst of this storm. So there are issues for the future. If we're going to really avoid this in future, the stronger public health systems are going to be needed with a strong community focus. But within that, and broader than that, we've seen health systems, and you said it, right now, your greatest chance of dying from COVID is not necessarily related to the treatment you receive, it's not related to the variant. Your outcome in COVID is predetermined by your health history. Whether you've had hypertension, diabetes, whether you've had years and years of badly managed underlying health conditions. It's one of the single most predictive and prognostic factors as to whether you will die from COVID. The die was cast, the dice were thrown a decade ago, 2 decades ago, 3 decades ago for most people who had no access to, and still don't have access to, diabetic prevention and therapy, hypertension prevention and therapy. We look at the mental health impacts of this now, and yes, everyone's affected psychologically, but look at so many unmanaged cases of severe mental illness who've now become more isolated and have even less access. How much better would they have been able to weather this storm if they had access beforehand to proper therapy and proper care? So we have set the seeds of our own destruction by not having universal access to affordable healthcare, high quality, affordable healthcare as a minimum basic human right for every person on this planet. And we're paying a huge price now in a pandemic for the lack of that basic human right. The seeds of our pandemic destruction have been set in how we've developed and invested in healthcare, which is not very well, not very equitably. And we have to fix that, because our ability to cope with an epidemic is almost predetermined by the basic health strength and resilience of our healthcare system, which takes years and years to build. And as we've seen, weeks to break if it's not strong. Weeks to break. We saw healthcare systems in the most industrialized countries in the world, the sophisticated countries, brought to their knees in weeks. Is that the kind of health system we want? One that runs on 100% bed occupancy with a tiny proportion of high support beds, with absolutely no surge capacity in health workers? You know, the expansion of the health workforce in this response hasn't been to expand the health workforce. We've just expanded the hours and days that the existing health workers work. And 90% of those health workers in the front line are women, who often have to go home and take care of kids and have to deal with all of the other issues. So we look around the world, 80 to 90% of frontline health workers are women who live in places where they have so many other responsibilities. There's no support, and they've been asked to work the extra hours. That's all we've done. That's what surge has meant in this response. Just get the same people who've been overworking before to do even more work more days, don't take their holidays. That's how we've expanded the workforce in health. How credible is that, or how incredible is that as a means of building resilience into our system? So Jennifer, I couldn't agree with you more. We are paying a price for a poorly articulated and developed health system with a workforce that is clearly underprepared, understaffed, undertrained, underprotected. And we've expected our health workers to go day after day, week after week into the front line without adequate protection at times, without adequate training, without adequate rest. And in that sense, if we're going to prepare for another pandemic in future, and if we're going to deal with all of the other health threats that we face, we are going to have to shift to a more primary healthcare oriented approach. We need to preserve health, the preservation of the health we have, the promotion of the health we have, healthy lifestyles, a real focus on prevention and primary healthcare, less of a focus on highly expensive tertiary care. Yes, it's important, it's there, we need it, but right now in most countries in the world, the pyramid is the other way around. We focus our investments, we even focus our media attention, we focus all of our attention on the smallest and most expensive part of our healthcare system. And yet, when you see the countries that have been successful in this pandemic response, they've often been the countries who've invested in basic community-led enterprise, community-led health responses, and who have a much better distributed public health and healthcare infrastructure. So for me, universal health coverage is the answer not only for our health needs, but it's also a major, major pillar of our resilience to the next pandemic. And this is embedded in the SDGs and in the development agenda. No longer is achieving SDG 3 a priority just for human rights. It is an absolutely existential priority for our society in terms of protecting us and protecting our health security. Over.
Thank you. Akio Takayanagi, would you like to put your question to Dr. Ryan? You'd unmute, please.
Yeah, thank you, Justin, and thank you, Dr. Ryan, for your presentation. Just a quick question. If we talk about the rights-based response and also response with gender perspective, what is your strategy of working with UN human rights bodies and also UN Women and other UN organizations working on gender issues? That's a quick question. Thank you very much.
Great, thanks. With specific respect to the COVID response, I have the the pleasure and honor to be the UN Crisis Manager. I chair the UN Crisis Management Team. We have 23 different organizations in that, and we have the UN Office of Human Rights, we have UN Women, we have many of the other organizations. From the very beginning, we've integrated a human rights-based approach and a focus on women and girls and other issues into the overall thinking of the UN system and into informing all of our policies and informing all of our ways of working. I mean, this pandemic has had a differential impact on many vulnerable groups, but in particular has had a differential impact socially and economically on women and girls, and particularly with relations to gender-based violence, which has increased significantly since the beginning of this pandemic. So just to reassure you that we have been working hand in hand. We've also been very careful in our data collection to always, we can collect gender and age disaggregated data as a standard within the House, and we analyze all our data accordingly. So we have tried to look at this pandemic through that gender lens and continue to include that approach. In terms of human rights, absolutely, we've had a number of publications that we've done with UNHCR, IOM and others on guidelines for the management of COVID-19 in prisons and people in detention, which is something that has concerned us since the very beginning. And I can go through more detail, but we can always do better. But I would like to say that we've had that at the center of our concern since the beginning of the pandemic.
Dr. Ryan, we know that you're under pressure. Can you take one more question?
Sure, for an Irishman, anything, yeah.
Isa Tosh, would you like to put your question? Is Isa there?
Yes, I'm trying to unmute myself because the system doesn't work it's not kind to me today. Thank you very much, Justin, and thank you for the opportunity. I'm Isabella Toth. I work for CORED in the Netherlands. Well, that is an organization that has a very large health portfolio, and we have been busy from day one in most fragile settings on the topic. But my question goes beyond health. I put it in the chat. How do you see the power and the leverage of the global civil society collective? Because it is, I mean, it sounds very, very alarming, and we know it is alarming. We see it every day. But what can we do collectively, according to you, as civil society to propel the agenda into the right direction? Health, but also beyond. Thank you.
Great, thanks. And yeah, I think certainly in this issue of COVID and access to vaccines, I think one of our problems, our weaknesses and failings has been we haven't had civil society enough at the center of this debate and enough at the center of the design of everything we've done. And I think we're paying the price for that now in not having the influence we need to drive the right decisions around equity. I think we need civil society at all levels. It's not about civil society at the global level. It's good governance. And people have asked me in the past about, Dr. Roy, what are the most important things when you deal with epidemic response? And I often give the answer, three things. Three most important things when it comes to epidemic and pandemic response are governance, governance, and governance. And I don't mean government, I mean governance, and how we shape and organize ourselves in response to a threat. How is that governed, managed, curated, stewarded? And I think our current forms of government and government equaling governance is not an equals. I think government thinks that government equals governance. I think governance is a much broader concept. And I think governance must include community, civil society, and others. We govern ourselves. Democracy, again, going back to my Greek, is demos and kratik, Demos is all people and kratik is power to all people. That is all democracy is. The problem is power is too centered, whatever the ideology, power is too centered in the hands of too few. We need a broader a new contract for our future society when it comes to the existential threats we face. We need to deal with massive threats like climate change, like human rights and injustice, conflict and pandemics now and other things. They will not be dealt with by a purely government-oriented approach. We need an evolved form of governance where civil society, communities.
Can I ask us, Justin, very quickly, because I want to come back to what Jennifer said earlier in her question, because then, I mean, again, with the power of leverage, do you think that the moment, the magnitude and the scale is serious enough that the governance model of the future will change? Or do you think that we will fall back into business as usual? And how can we really avoid that?
Yeah, that's the $6 billion question, or the $7.4 billion question if you give $1 for every person on the planet. I hope we don't. I mean, we need government and we need strong governments, and part of the failings in this response and part of the success is governments who've been responsible and accountable and transparent have done well. You know, and governments that haven't done so well. So government is important and accountable governments are important. But when we talk about how we manage and develop governance for the future, then I hope when it comes to issues of social and human rights and health issues, that we design a better way of driving decision-making and driving accountability. And there's a greater voice for civil society at all levels of the health architecture and all levels of decision-making in the health space. Over to you.
Dr. Ryan, we could listen to you all day. It's been really interesting, but you've been very generous with your time, and I think it would be unfair to take any more of it. Just to say, I think that we have all been impressed by your insights and experience, but particularly by the passion with which you have spoken to us. And I think it will help us to carry that passion forward into the rest of the discussions we're going to have for the rest of this webinar. But just on behalf of everybody, of CPDE and all of our participants today, to say thank you so much for giving us this time and for inspiring us in the work you do. And we wish you all the best as you continue to lead the WHO's efforts in countering the pandemic. God bless you.
Great. Thank you, and congratulations. I meant to say it before. Congratulations on the CPD, the report. And I've not got through it all, but I've certainly got through the main bits, and it's quite impressive. And I really like the way you've looked at democratic ownership and inclusive partnerships, transparency, accountability, and that focus on results. I think that's really important, and I think that's a very important part of your thing. Too many times, you know, we speak in abstractions. We really need to look at how we generate results, how we measure results, and how we use results to drive what we do. So thank you for that, and good luck with the rest of your deliberation.
Thank you. So as Dr. Ryan takes his leave, we can move on to the next item on our agenda, which will indeed be a presentation of the research study. And Beverly Longid, our co-chair, and Josefina Villegas from Argentina, who's a part of the CPDE youth sector, will present this part of the program. So Beverly, over to you.
Hi, thank you, Justin. Thank you, Dr. Ryan. That was quite a direct and powerful response to the question. So good morning, good afternoon, and good evening to all our participants and speakers. So today we will be presenting the global research findings of the CSO Partnership for Development Effectiveness, CPDE, published as The World in Lockdown, Development on Hold, a special report on the ineffectiveness of COVID-19 response. As we have seen, the pandemic has caused unprecedented repercussions in all aspects of our life that will impact the world in years to come. While COVID-19 has affected all of the world's population, its impacts are felt unequally. The poorest, the marginalized, and most vulnerable sections of the population suffering the worst. Thus, the CPDE embarked on this research to highlight the situation of grassroots communities and CSOs amid the pandemic and on the COVID-19 response. This is part of our commitment for effective development cooperation to support informed engagements of partner countries, development actors, and other stakeholders in making international cooperation effective. So how was this research undertaken? This research involved participants from 33 countries in 5 regional and 6 sectoral or constituencies of the CPDE. They used the CPDE framework paper to guide their research, the country research, and employed various methods for data gathering like desk research, key informant interviews, and surveys. But the research has the following limitations. One, the case studies focus on the cooperation principles of country ownership and inclusive partnerships, but with the addition of the human rights-based approach and leave no one behind. Thus, some of the case studies may not contain data and analysis on the 2 other principles of transparency and accountability and focus on results. 2, the case studies were also conducted from August to November of 2020 and might not fully reflect the COVID-19 related developments since then. So with this, what is the state of the CSO enabling environment? To contain the pandemic, national governments mainly implemented drastic containment measures like lockdowns instead of a comprehensive medical solution as of the primary COVID-19 response. The research supports findings that out of 188 countries, only 52% implemented health testing, while 97% carried out restrictive measures. These lockdowns heavily relied on police power to successfully enforce mass discipline, have failed to contain the pandemic, but it had far-reaching implications on the global poverty rate, logistical flows in the supply chain, job security, income and livelihood losses, and on the survival of micro, small, medium enterprises and the informal economy. Worse, in a situation of poverty, many states, as mentioned earlier also, took the opportunity of COVID-19 to further erode the space in which civil society operates. This undermined our position as development partners and as independent actors in our own right, and in many cases, directly repress those that are critical of their government. So now, how did COVID-19 affect official development aid? The lockdowns imposed globally at one point put economic activities to a halt, resulting in severe contractions in economies of both donor and recipient governments. This definitely will affect ODA allocation and spending. This is worrisome. As it has been in pre-COVID-19, ODA to developing countries was well below the commitment of 0.7% of the gross national income. But the OECD DAC identified public health interventions as key forms by which ODA can be allocated and counted, such as on healthcare systems, information and emergency communications, expanded testing, vaccine research and development, and humanitarian response to mitigate the impact of COVID-19. At the same time, it also noted the need to protect ODA commitments to stop potential losses due to the pandemic. Now, the research also shows that there has been a decrease in bilateral commitments, but multilateral donors increased their commitments. There was a marked boost in other official flows channeled through international financial institutions and multilateral donors as compared to previous years. The highest aid allocation went to the social infrastructure sector. Meanwhile, the IMF World Bank has given the biggest chunk of its funding commitment to Sub-Saharan Africa and South Asia. But before we go to the general picture of evidencing effectiveness, let's take a look at evidencing effectiveness and COVID-19 response in Latin America and Caribbean. And this shall be shared by Josefina Villegas, the coordinator of the CPDE Youth Constituency. Josefina, you have the stage.
Hello, everyone. Thank you, Beverly. And thank you, everyone, for being here. All the hard work put into organizing this webinar. So I have a very, very short time to present a little bit more of what the regional and sectorial, some of the regional and sectorial outputs were for the studies. And we tried to highlight main trends. So in terms of socioeconomic impact, the exacerbating gross inequality in the region, which we can also say that is worldwide, happening everywhere. 45 million people pushed into poverty, job and income losses. Of course, the impact on women, also mentioned by Mr. Ryan, and external indebtedness. From the youth side, we've highlighted also the impact that this pandemic has had in the devaluation of currencies, and of course, the worriness regarding debt, and the impact on food sovereignty and the access to basic services and goods. Particularly affected have also been young people working in the informal sector. Next. In terms of country ownership, some of the main trends highlighted have been that in Peru, Argentina, Ecuador, and Venezuela, although there have been national strategies, there is no plan or strategy for follow-up on results. So we can see that governments are basically coping with things as they come, with no serious planning. Except for the Argentinian case, CSOs throughout the regions and movements have not been formally consulted. And this is a research study where 8 countries were under analysis. So it's a considerable amount of governments not taking CSOs into account. In terms of what were the outcomes from the youth sector, we have some trends regarding CSOs consultations being cosmetic, not having any real or available information of what the lead up on the consultations have been. And outcomes from consultations are not made public. There is a lack and a need for community dialogue, which was also highlighted in the previous presentation, and to have stronger mechanisms to hold donors accountable. Next. Inclusive partnerships. Well, there is again the highlight of not sustained or formal dialogue with CSOs and the strong influence of private sectors, private actors in government decision makings, particularly in Peru and Ecuador. This also impacts in terms of no relevant CSO or youth engagement in the processes. Next. Human rights at the core of the COVID-19 responses. These were the 4 areas that were looked into by the study. Of course, the pandemic has deepened the pre-pandemic structural conditions of poverty. This is nothing new. It has just worsened the inequality, which was already pre-existent. And we've faced cases of repression and other violations for community workers, relief volunteers, popular organizations. From the youth side, we've also questioned the health definitions provided, since they restrict and violate relevant and basic human rights. And what came out in many of the studies was a real and deep questioning of what is the health definition that's being used and how is this being used to restrict human rights, freedom of assembly, freedom of expression. We face censorship in media and the internet as organizations, and we've want to highlight the role that the organizations have had on the ground to guarantee equal distribution of essential commodities during the crisis. Particularly relevant is being the role of youth in rural areas by providing security to the population, specifically in terms of food and access to resources. And I think that we have one more short slide on main recommendations, out of which I think that Beverly is also going to highlight recommendations, but I would like to, these were out of the youth sectorial study, and I would like to highlight the relevance of having CSOs considered as essential services as they complement government efforts. I think that's what I highlight, basically. Thank you, Beverly. I give it back to you.
Thank you, Joe, for that presentation. It was really good to know and quite inspiring to hear of the role of the youth in addressing the COVID-19 pandemic. So now let's take a look at the general picture of evidencing effectiveness. So in terms of country ownership, some donors still use country systems to channel COVID-19 aid, but there is scant evidence, small evidence, that such is aligned with national development strategies and priorities. The legitimacy of national pandemic responses has also been questioned because of the big or the outsized role of the military in planning and implementing the COVID-19 national response. In terms of inclusive partnerships, CSOs have been excluded in the formulation of national strategies, if any, and many governments also constricted the space in which civil society operate. In countries where CSOs are afforded some space, it's only the larger, more established, and more government-friendly or probably organized are invited or allowed to participate. In relation to transparency and accountability, while many governments have put up centralized portals and public databases, citizens and the CSOs often question the veracity of information and the timeliness and frequency of their release. Most governments have no public engagement and feedback mechanisms, oversight bodies, and grievance mechanisms in relation to the COVID-19 response. Now, on focus on results, results are reported in terms of quantities and financial amounts. However, these do not particularly reflect if these were for COVID-19 or spent for COVID-19 response or even aligned to sustainable development. There has been minimal effort to expand the deliverables, including efforts in addressing institutional weaknesses in national governments. Now, on human rights and leaving no one behind, governments have bypassed or violated civil and political rights, laws, and norms to varying degrees, under the pretext of controlling the pandemic. These risk measures led to the intensified violations of the rights, especially of women and children, indigenous peoples, youth, migrants, peasants, and workers. So that's the general picture. So now, what are the key recommendations from the research? In terms of ownership and exclusion, this can only be achieved through genuine multi-stakeholder partnerships that are grounded on democratic and equal participation. This needs not only the involvement of civil society in all relevant levels of decision-making, but also our free access to information. Development aid should not come with conditions. Donors should extend more grants instead of loans while increasing local resource mobilization. Governments should also regularly share and publish timely and accurate, if not truthful, information and allow free access to information and data on all matters related to COVID-19 through the creation of a unified platform for citizen access. An effective monitoring and evaluation mechanism shall indicate if the desired results have been achieved. Governments also, in terms of transparency and accountability, must adhere to human rights obligations and norms. This shall ensure that gender equality is upheld, public health system and social protection measures are strengthened, and the needs and concerns of the underrepresented and marginalized groups are included in the COVID-19 responses. At the minimum, civil society should be allowed to operate free of any unnecessary interference or control of their practice and operations, and given spaces to contribute to official processes related to the pandemic responses. So in conclusion, we constantly hear references to a new normal, Build Back Better, that defines new parameters for our way of life amid and probably after the COVID-19 crisis. These discourses appear to challenge prevailing market-driven policies on development and thereby create openings for alternative people-centered approaches. However, current discussions point to new mutations of the same old policies that bail out corporations instead of communities in need and prioritize business interests over the welfare of people in poverty. We hope that this research helps in putting people at the heart of development and in articulating the importance and necessity of effective development cooperation in successfully addressing the pandemic and in the building of a new and better world. We encourage all to read the research in its entirety, and we in CPDE, the CPDE, would be more than glad to receive your feedback, comment, and updates. So that's it. Thank you very much. Back to you, Justin.
Thank you very much, Beverly and Josefina. That's been an excellent presentation. I think we've got the main points from the report there, and I hope it has whetted people's appetite to study it more closely as you have suggested. So we move to our next speaker, and we're delighted to have with us on this webinar Ulrika Modeer, the UN Assistant Secretary General, who is also Assistant Administrator and Director of the Bureau of External Relations and Advocacy at UNDP. Ulrika, you're very welcome, and we're delighted that you are contributing to our webinar, and you will talk to us about COVID-19 and its impact on implementing the effectiveness agenda at country level. Thank you.
Thank you so much for this opportunity, and thank you so much for the very timely report, because if we wouldn't look at what's actually effective and development effectiveness and the principles that we have said that we were to adhere to in this time, when would we do that? I think it's a really timely report, and of course then representing not only UNDP but also the UN development system, and listening also to Dr. Mike Ryan. I think, as he said, the dice were thrown way back, and how we build not then back but actually forward is a key lesson that we need to learn now to do things differently. And UNDP has been leading on behalf of the UN system on the socio-economic response. And I was also thinking, as I was listening to the conversations earlier here, that we issued in 2020 or late 2019 our Human Development Report, focusing then on what we saw were the main concerns with regard to the implementation of the Sustainable Development Goals. And we were then talking about the increasing inequalities. We were looking at the increasing inequalities with regard to digital solutions, the digital divide within, but also then of course between countries. And something that hasn't been mentioned today, but that is of course part of the discussion that we need to have, is access to internet, and how we can then build also, as we learn from the situation that we're in, the possibility to have these transparent discussions, to bring the insights, but also then hold decision makers to account. And how can we then as the UN be part of supporting that? And I promise you that UNDP will be part of that journey to see how we can close the gap with regard to the increasing inequalities that we see as a main challenge with regard to the Sustainable Development Goals, and that have enabled the spread of the pandemic, whether we speak about the least developed countries and those countries who do not at this time have access to the vaccines or a health system that works, or whether we speak about populations also in the richer countries, kids in the suburbs who live in small apartments and do not have access to online schooling, even though they live in the richest of the countries. So really huge thanks to CPDE and the commitment that we have made together to see to that we adhere to the effectiveness principles. And as we've heard, we have still a lot to do. And this is, of course, why the report is so important. And let me then just reiterate what we know as the UN development system. And you were also speaking about the multilaterals stepping up and being the main providers of support to countries as we speak. Well, we really adhere to the principle of country ownership, but then taking this country ownership also beyond the governments, because while our governments are our main interlocutors in all of this, we know, and this is a fact, and we see it in everything we do, that those countries who actually have an inclusive governance system, they succeed so much more. Handling these type of crises and situations. And of course, as the UN and as the United Nations Development Programme, UNDP, we need to, as part of the leadership of the socioeconomic response, see to that we have more inclusive discussions. Now, we also know that a lot of countries, they've had a difficult time to handle this shock and crisis. And what happens then when we don't have these inclusive governance systems, the transparency and the possibility for accountability, also beyond, as you were saying, the well-organized civil society in capitals, is that there is a way to kind of go back in the development that we want to push and see with regard to the broader ownership that needs to take place. So we really need us also building on the findings of the report to understand how can we also, and most of all, perhaps in times of crisis, have systems in place that actually allowed this participation, the transparency and the accountability to strengthen what we believe are true country-owned systems that goes also beyond governments, to also make full use of the assets that are there, the frontline workers, civil society being key for everything that countries need to do to address this type of crisis. So country ownership, of course, incredibly important. There are issues already coming up, I believe we should recall, in the 2019 effectiveness report, despite or even alongside marked improvements in recipient countries' own planning processes. And we have reasons actually as UNDP to believe that these situations that we see with less of country ownership can be challenged. They are now, and they can be challenged onwards as well. So as we look at the development finance flows towards countries with decreasing foreign direct investments, with decreasing remittances and also decreasing ODA, we need to look at the principles of development effectiveness and also challenge countries, partners, donors in this regard, because otherwise it will be incredibly difficult to leverage the resources that we need to leverage in order to address the weaknesses that have actually enabled this crisis to unfold the way it has. And as Dr. Ryan said, I mean, it's a crisis that goes well beyond, of course, the pandemic. And this is what we're also discussing here today. And something you can read about also on our website, undp.com, where we do a continuous follow-up on the socioeconomic crisis unfolding, of course, also affecting the health area, but many, many more areas, as I mentioned. Let me just mention some few programmatic responses that we have worked with. We have really tried to adapt to what partners need to rapid change. Over the course of 2020, we mobilized 1 billion in direct COVID response, which is about 20% of our expenditure. And it's somewhat difficult to do that because we are also, as the UN, tied to a lot of project funding, as many of you are in civil society organizations. So releasing those funds, being agile in order to respond to different needs on the ground was something we looked into early on, and we managed to do at least partly. And we have done that hand in hand with partners, of course, then, as I said, working with governments, but also trying to get that whole of society approach. So in our rapid funding facility project, for instance, in Bangladesh, we saw over 1,000 judges, lawyers and clerks trained in holding virtual courts, upholding rule of law, allowing then the social contract to actually work in the midst of the crisis is essential. In Pakistan, we worked with our digital platforms, as I mentioned, that we have started to look at to really see that we get that outreach. We did that together with both academic and private sectors, but also involving civil society. And we have also helped to launch telemedicine initiatives in Libya and other countries to really get the outreach that we would want to see. There is also a lot of examples, of course, working with other UN entities. So in Bolivia, as one example, we worked with OCHA to set up a situation room for the government where they could really understand from the perspective of the citizens how the situation was unfolding and getting a lot of input. So we worked also together with the Pan American Health Association organization in this, and with our colleagues in WHO. And this is an experience that we would want to look more into as we also learn from each and every initiative that we have taken at country level. Media engagement, many of you have spoken about the importance of outreach, transparency once again, and this has also been part of the support of UNDP. Stemming also the infodemic that you've heard the UN mention again and again, and the risk, as we have seen in many countries, that hate crime would also increase throughout the crisis in parallel with the health crisis unfolding. So addressing that in many different ways has also been part of our response. Now, if we look at the crisis also as an opportunity, and if we can, also based on the group that we have here, the multi-stakeholder group, look at a different paradigm for understanding how CSOs can be part of a response like this, how CSOs can be part of also addressing the problems, the underlying problems that make us end up in a situation like this. We need to recognize the key decision that was taken, that CSOs are also development actors in their own right. And I think that the report, as we have seen, have shown, as we have done again and again, impressive examples of roles of CSOs, the work that they have done in the pandemic, from helping governments to disseminate key messages and reaching those vulnerable communities. This has also been part of our job, doing that in coordination with civil society. But the critical context that needs to be emphasized and was also mentioned, and I would like to do that, is how do we then reach beyond the big NGOs, many times based in the big cities, to reach and support the resilience at community level. And this is something that we would like to look into as we plan onwards, also the socioeconomic response and the way to get us also beyond recovery towards the achievement of the Sustainable Development Goals. So for us, this is a true lesson learned. We want to do it together, and for us the report is incredibly valuable because we can learn through the report, and I will take it back and bring it into the discussions of the UN development system as we plan onwards. Thank you very much.
Thank you very much, Ulrika, and thank you for your encouragement on the work that has been done on the report, and for giving us that very good overview of what UNDP has been doing. I understand you have to leave us in a few minutes, but would there be time for one question if somebody would like to put a question to you? Would anyone like to put a question to Ulrika Modeer? I've taken the participants by surprise, but maybe so maybe I might just ask one, which is, you talked about the crisis as a moment of opportunity. One of the things that has emerged from the work in GPEDC is the lack of trust between governments and civil society. And it seems to us that this is an issue that has to be tackled. Given how civil society has responded to the pandemic, do you think there is a possibility that this could be part of a new beginning of government and civil society working on the basis of mutual trust? Can you unmute?
Now I can, yes, now I can. I wasn't allowed previously. No, and of course for UNDP, having governance as key mandate within the UN family, this is also something that we need to look closer into. Mike Ryan described the need to rebuild the social contract, but as we both have said, we can testify and we can point at the fact that the countries where there is a high level of trust, and this is something that we have also looked into our human development report, they also succeed better, or they can handle this type of crisis even better. So of course, then with our presence in 170 countries, what we will do is to engage governments and decision makers also in parliament in the understanding that we need to rebuild that trust. We need to rebuild the social contract, and we have evidence and proof that the countries who do that, they can actually handle a crisis like this in a much better way. So I think we will see much more of that. And I would really like to invite all of you who haven't looked at the 2 latest human development reports, do that, because besides looking at the increasing inequalities, given what we see now and what has been unfolding, we also look at the pressure on the planet. And this was also mentioned very briefly by Mike Ryan in the beginning. But of course, the pandemic and future pandemics will also be enabled also by the pressure on the planet that we are also discussing in a human development report. But rebuilding trust or building trust from the very beginning is part of our work. And I'm happy to come back to you and discuss that in detail onwards as well.
Thank you very much for that response, and thank you again for your intervention. It's been very important to hear what the UN has to say about all of this, and thank you for being with us this afternoon. We have our next speaker has yet to join us, was scheduled, is Monica Asuna from Kenya. So we will move on, and hopefully Monica will join us a little bit later. We are in touch with her, and she is intending to join us. So I wonder, if Gabriela Jesus is ready to talk to us. Gabriela is the head of social inclusion and protection, health and demography at the European Commission, and she will talk to us on making aid transparent, predictable, and accountable to improve the effectiveness of the pandemic response. Gabriela, over to you.
Thank you very much, and good afternoon, everyone. Of course, you're in different time zones, so I speak from Brussels. Thank you, and thank you also for the very interesting research paper. Certainly, this is also very valuable for us. Of course, we live in a very difficult context, and in my unit, we also look at questions of inequalities and also the rise of poverty, of extreme poverty. So we are certainly very, very much concerned. Now, starting with the overall crisis response from our side, well, you are certainly aware that the EU and member states, they reacted collectively in a so-called Team Europe spirit, and they mobilized over 40 billion euros for the crisis response. And this is basically, the Team Europe is a new, let's say, approach for us. And in order to maximize impact, pool resources of, as I said, EU member states, but also of the development, European Investment Bank. And the distribution logic follows the needs of our partner countries. So it takes into account added value, efficiency, and complementarity. And what we seek to offer to partner countries is the menu of financial and technical support options, which includes budget support, but also technical assistance, blending, guarantees, equity and liquidity to the private sector. So what we are aiming is to have an intensified European coordination also at country level. Now, looking at your report, I try to react to some of the points raised there, and starting with the whole question of development effectiveness. And of course, we certainly need to ensure that the way we pursue any new priorities, such as responding to COVID-19, promotes development effectiveness. And of course, the pandemic is a moment when it is even more essential to coordinate the many potentially disparate responses behind a commonly agreed and prioritized set of results. And of course, when we look at immediate response, where of course what we also try to do is to respond to humanitarian needs, health needs, but also address the social and economic impact. But of course, what we also need to bear in mind is that we need to build the systems and capacities for the future at the same time. And, I'm also dealing with health. And of course, we need to have the health systems, as earlier also referred to, resilient enough to prevent and respond to reoccurrence of diseases and to new pandemic threats. It is also clear that we need to improve the system to monitor effectiveness. As you know, the EU has advocated very much for the Global Partnership for Effective Development Cooperation. And part of this, of course, is to come up with ways to apply effectiveness principles to ODA delivered through various actors. But of course, the other part of it is to develop further and strengthen ownership, alignment, and inclusiveness. And when it comes to the whole question of country ownership, I can tell you that from our side, the domestic resource mobilization will have to play a key role in the recovery, in the sustainable recovery efforts. We know that, as you know, the EU has also been a strong advocate for instance, for debt relief in order to ensure sufficient fiscal space for governments to respond. And this, of course, is very important on the social side. And as you know, the European Commission has been playing a leading role in supporting domestic resource mobilization. And I can give you an example of the Addis tax initiative, where essentially we succeeded to double technical and financial support to domestic resource mobilization in partner countries and promoted policy coherence for development. And, many partner countries made the fair point to have their voices heard more in international tax debates. And the Commission has financed the participation of 72 partner country delegations in international tax discussions. And we also very much appreciate the close relationship with civil society on tax matters. Now, when it comes to the alignment of ODA with domestic development priorities, of course, this is absolutely crucial. And in the context of the response to COVID-19, we have been engaging in dialogue with partner country counterparts in order to coordinate our action and align priorities. When it comes to conditionality, the Commission's COVID response was not subject to it, but it did follow objectives, results, and indicators which were agreed with our partners. On the inclusive partnerships, CSOs, NGOs are our key implementing partners for various actions of our COVID-19 response. And as you know, it is our firm commitment and also part of the mandate of Commissioner Urpilainen to have a dedicated focus on supporting civil society and to give them a greater role in development cooperation. So we are committed to a more structured consultation, and we have started this in the context of the Policy Forum on Development on EU programming.
Gabriella?
Sorry, I'm running out of time. Hello? Hello, can you hear me?
Gabriella, can you hear me? It's the moderator.
Yes, I can hear you perfectly. Can you hear me?
Yeah, there is a problem on your line of an echo. I'm just wondering if the technical people might have a suggestion. Maybe there's feedback. Is there any suggestion for Gabriella about her sound?
Hi, Gabriella. If you have,
Hi.
If you have two devices, maybe we can turn off the other device because there's feedback.
I have another device. I can turn it off. I didn't access the webinar or any other conference with it, but I turn off all my phones. In any case, is the echo still there?
Yes, the interpreters are having a hard time picking up the sound. The echo is quite loud. Are you on the English channel?
Yes, I'm on the English channel. It seems to me, yeah.
Okay. I think
yes, I am on English.
All right. Okay, Gabriela, you may continue.
Okay, I'm sorry for this technical issue. And so basically it was about inclusive partnerships. When it comes to crisis response, the EU adopted a two-tier approach in its response to COVID-19 and its cooperation with international, with civil society organizations. I hope my system is okay. It's back. And so essentially, one of these strands has been orienting towards COVID-19 related priorities funds of the civil society local authorities thematic program, which has not yet been constructed or published calls for proposals where and if they were appropriate. But also our intention was to preserve the capacity of existing organizations, civil society organizations, including local members and affiliates, by pursuing ongoing programs during the crisis and applying flexibility measures in cooperation with our partners. Now, the question of transparency and accountability is really key for us. So the European Union and the member states agreed last June to establish a joint monitoring system that will track and trace the financial commitments of the EU and its member states throughout the year to ensure transparency and accountability. And these are regularly published. It is a joint monitoring table which shows funds committed, expenditure according to the priority areas of emergency, health, sanitation, and socioeconomic, broken down by regions and also commitments by country for the Commission and member states. I'm also glad to inform you that on the 8th of April, it will be the anniversary of the Team Europe approach, and we will be publishing all the reporting tables of Team Europe, EU and member states collectively for all EU institutions on our website. And the programs and projects which are responding to COVID-19 are implemented according to the same modalities and need to respect the procedures, monitoring, accountability as any other project. So this on the accountability side. Now, finally, focus on results. This is very important for us, and we are currently working on a fast-track evaluation of the EU's external response to COVID-19, where we will focus on the Commission's contributions, but also take into account the contributions from member states. And we will have a final report to present in September. But we are also currently thinking on how to put a stronger emphasis on results in the regular reporting on the COVID-19 response. So these were, let's say, the main comments and let's say reactions on the findings of your report. And I really suggest that we continue the dialogue because we are certainly very committed to all the findings and recommendations you are presented. Thank you very much.
Thank you very much, Gabriela. That was a very comprehensive overview of the European Commission endeavours across a wide range of areas. We're very interested that you are undertaking your own evaluation now. The learnings from that, I'm sure, will be very important to all of us, particularly to fellow donors. Also, we just should acknowledge the support that we received from the European Commission for the work of CPDE, and you are one of our regular and main donors, and we do really appreciate that collaboration and the emphasis that you do put on the role of civil society, which is in the whole development endeavor. So thank you, and maybe as we come to some questions closer to the end, maybe some of our participants might like to put a question to you. We'll move along, and I think our speaker from Kenya, I don't see her on the participants list. So we now have an input from Catherine Turner, who has done research for the international civil society organizations that is parallel to or complementary to the research we're presenting today as CPDE. And I'd ask Catherine to share the main findings of her research for us. Catherine, over to you.
Hi, it's a real honor and a pleasure to be here with you all, and I'm going to move at quite a pace because I know there are time constraints, so I apologize in advance to the interpreters and everyone. If we could move on to the first slide, that would be great. Thank you so much. Just to say that the aim of this research was to provide a snapshot to highlight the main impacts of COVID-19 on CSO's ability to operate effectively. It was initiated by the INGO constituency group of the CPDE, but it's to be used to help identify next steps for the constituency in the coming year. Next slide. So it's a qualitative study based on personal reflections, primarily given in a survey and 12 interviews. So as it's based on personal reflections, these are very valuable and important, but it's not a comprehensive review. And also it's very much from the perspective of international CSOs. Next slide. Thank you so much. Now, just listening to the previous speakers, a lot of this echoes a lot of the points that have already been made, and I'm sure a lot of this will also be familiar to this group of participants. But really, the first questions we asked were around the main impacts to CSOs, and clearly chief among those were limitations to CSOs' operating environments. So obviously the unprecedented scale and complexity of the problem, particularly the secondary economic and social effects, were a huge challenge to CSO effectiveness. As we've also heard about today, and there's a lot written about this, the shrinking civic space under the guise of emergency measures. Everyone mentioned this in the interviews. COVID-19 has provided the perfect cover for repressive governments to crack down. And there are examples of personal threats, raided offices, frozen bank accounts. But I think also, as we've heard earlier, what's also concerning is while a number of governments have engaged with CSOs in their COVID responses, there were also a number of governments who refused to engage and authorities who refused to engage with CSOs or share key information, and many decisions were reached behind closed doors. And that's also in the global north, we got examples. But on the reverse side, this also strengthened CSOs in their resolve. I heard a lot about that. But also the proportionate restrictions, the legitimate ones just to curb the spread of the virus, have also had an impact. It's the physical distancing and movement restrictions have made people harder to reach, for instance, and there were other examples given, for example, of community gatherings which couldn't be held by virtual means, such as peace and reconciliation processes that took place in communities. As we've also heard, digitalization had a kind of a two-pronged effect. In many ways, there have been many upsides. I mean, the fact that we can all meet today is testament to that. And some said that, you know, advocacy became more efficient. You can be in a conference in one part of the world in the morning, in another part of the world in the afternoon, or very early in the morning or very late at night, depending on where you're based. And also participation in international conferences has been opened to many CSOs that would not otherwise have been able to join. But on the downside, you know, those important sort of face-to-face discussions that you have when you're establishing relationships or at the side of meetings that are so key to influencing couldn't happen. And also programs, you know, in programs, sometimes there's just no substitute for face-to-face. If you're having sensitive discussions on sensitive topics or discussing complex financial matters, they really need to be in person. But above all, it's the digital divide that we've heard a bit about today that was mentioned by everybody. You know, not everyone has the same internet infrastructure or access to tools. And so this not just hampered the way some CSOs could work, but also obviously the hardest to reach were often the most vulnerable, and those could not be reached through these means. And it's also not just a North-South issue. I think, as this was alluded to as well, it's also within countries, within communities, or even within households, depending on who has access to these things. In terms of funding, international CSOs, most but not all, said that donors had provided sufficient funds for the emergency and had been flexible on the whole in their processes to enable them to be adjusted, programs to be adjusted to meet COVID needs. But they also said that administration could be over bureaucratic at times, which slowed things down. And there was a perception that funding directed to the COVID response tended to be in the narrow health sense. And so this could be at the expense of other important things. And I think there was also a lot of concern expressed and even anxiety about cuts in the medium to long term that were looming on the horizon and what effects that could have on the effectiveness of responses. There was also particular concern for national CSOs. It seems that many have been struggling just to survive. You know, they have had to do more, but with access to less funds. And examples were given of halting funding because the projects just were suspended, or no local fundraising was possible, or gathering collections from supporters due to the COVID restrictions. In interviews as well, it was also suggested that national CSOs were not always included on funding calls for the major donors. In terms of impacts on staff themselves, I heard a lot about isolation, stress, burnout. These were all phrases that were used a lot. Plus, you know, staff, you yourselves, you know, may have dealt with the virus, have suffered from the virus or the loss of loved ones to the virus. But on the reverse side, there was also a lot of pride, I would say, in the sense that we were there and we've been doing what's been needed. If I could have the next slide, please. Thank you. We also looked at the 8 Istanbul principles that you'll all be familiar with in terms of the framework to guide the effectiveness of CSO operations. I would have to say that unlike past studies, the COVID pandemic has really had an impact on all of these principles, mainly negatively, but also positively in some respects. Due to the constraints on time, I won't go through every single one of them, but I will focus on 3. And the 3 that I'll focus on are 1, which is respecting and promoting human rights and social justice. 2, embodying gender equality and equity while promoting women and girls' rights. And also 6, which is pursuing equitable partnerships and solidarity. So if I could go to the first one. The next slide, brilliant. Respecting and promoting human rights and social justice. So externally, this remained a huge focus of CSO's advocacy, communications, and so forth. But in terms of implementation, this was clearly very compromised because the most vulnerable and marginalized in society were typically also the hardest hit and also the hardest to reach. So that exacerbated a lot of the gains that had been made. And then moving on to the second one, again, embodying gender equality and equity remained a huge focus of advocacy and communications by CSOs. But again, we saw a giant step back in women and girls' rights, with women and girls being disproportionately affected by the pandemic, and other presentations have mentioned this too. And what also came through in interviews was the lack of women represented in decision-making around the COVID response. So we know that CSOs weren't always engaged, but just women were not involved in the decision-making, and that was at all levels. You can see internally as well, there was a more positive picture with diversity and inclusion policies and also flexible working for staff. But I do think that in terms of both 1 and 2, there is a lack of representation of women and minorities in senior roles in the sector, which was mentioned by some. Moving on to the 6th principle, This is a particularly interesting one, I think, simply because this is one that international CSOs have typically struggled with most in the past, and they've recognized that this has been a challenge. COVID-19 is no different. It's had both negative and positive effects on this, but despite a lot of local rhetoric over a number of years around localization and shifting the balance of power, the underlying imbalance appears to remain largely unchanged. And the reasons that interviewees and survey participants gave for this was the existing barriers to equitable partnerships that are still there, essentially, and primary among these were around sort of donor-led constraints. COVID-19 funding was still channeled primarily through INGOs, that was their perception. Also, there's increasing popularity of large-scale contracts, which was a trend before the pandemic, but seems to be continuing. And also the high levels of compliance and scrutiny required by a lot of the funders, which is understandable on many levels. Everyone understands that particularly bilateral donors do need to justify their expenditure to their parliaments, to their electorates. They also have to be sure that money isn't inadvertently going towards terrorism. All of these things everyone understands, but it does mean that INGOs are best equipped to implement these types of funded projects. Also, international CSOs and national CSOs simply just did not experience the pandemic in the same way, probably still are not experiencing it in the same way. You know, we've heard from, you know, just now I mentioned the funding divides and the digital divides, but there have also been, for example, divides in responding to shrinking civic space, in the sense of, for example, if your offices are raided, if your bank accounts are frozen, the international CSOs had recourse to legal support. They were able to get emergency funding from offices in neighboring countries. Even just that sense of solidarity that they got from being in a wider network, in you know, from the wider federation, I think they found helpful. But I think there were some tentative steps forward brought about by the pandemic in this area. COVID-19 has forced a lot of international CSOs to rely more on their partners through the movement, and physical distancing restrictions made that necessary. And they've also been forging relationships with new groups, less formalized groups, that they wouldn't have been able to do or wouldn't have thought of doing in the past. And so maybe that will continue beyond the pandemic. Also, in terms of digitalization, some interviewees talked about how many partner organizations have been opened up to them. They were able to engage with a wider range of staff and different levels of seniority, which, you know, hopefully all of these will sow seeds for changes in the future. And so moving on to the next slide. There are some final reflections. I think I'm just going to focus on 3 just because I'm conscious of time. But what I did want to discuss was the pandemic of inequality, which is a CPDE quote in one of your previous reports. But this is a theme running through everything, and it's, you know, it's what Michael Ryan was saying at the very beginning, and it came through so much in this research. You know, people did not experience the pandemic in the same way. The poorest and most vulnerable have been hit hardest by its effects. You know, digital tools as a positive response to this, and it's been a vital response in many instances, but it has left the marginalized more excluded and even further behind because they have not been able to access it in the same way. And also, as I've just been talking about, it's a marker in CSO's own experiences. And so I think this is something that we do need to look at. And so moving on to that second point, challenges for localization and equitable partnerships. You know, localization, shifting the balance of power, these have been a stated aim for many years. You know, we saw it in the Grand Bargain commitments, and you know, it's been an ongoing trend. But overwhelmingly, the interviewees found that this was still more rhetoric than something that we saw in practice. and clearly the levels of specifications and the stringency of donor requirements is one major barrier to this. And in fact, one interviewee even spoke of two different philosophies. They just don't, you can't have both almost. And so I do think that is an area for donors and CSOs to work together on, just to see, it's clearly a challenge, and clearly in the midst of crisis is probably not the best time to address it, but it is something that I think everyone does need to work together to take concrete steps to try to do things differently. And finally, I just, in this slide, I wanted to talk about the window of opportunity. I think on a more positive note, we've seen unprecedented challenges in the last year, but it has also brought opportunities. It highlighted issues that CSOs have been campaigning on like never before. One interviewee even spoke of it being an awakening that they sensed among the people that they normally lobby and talk to and try and persuade. This, plus the need for global economic recovery, is a rare chance for CSOs to articulate a clear vision for what that recovery should look like and organize together in a very kind of targeted way to push for it. But the note of caution, obviously, with this is that windows of opportunity do not remain open for long, and there is a severe risk of governments doubling down on business as usual just to get through. And so I think everyone needs to act with haste in order to push for that to be a new better recovery. And then finally.
Catherine, could we leave it there because we're running out of time? Is there one last comment you'd like to make?
I was just literally just going to leave this up there as the last bit.
Okay.
Just to say there are some next steps that the International CSO group are thinking about. I'm sure there will be more, but here I'll just leave you with those. If people have got others that they would like to share, that would be great. Thank you.
Yeah, thanks very much, Catherine. That's very valuable research, I think, as we all have to look at ourselves and our performance in this responding to the pandemic. And it's good to see the Istanbul principles being put to good use there. And one thing that struck me was the leave no one behind is more than a slogan. It is a real challenge, and those that are furthest behind are the ones being left furthest behind, and something I think we all need to bear in mind. So we have two more speakers to go, and Helen Home from CETA has been very patient and to wait for us, and Monica has joined us from Kenya, but we'll go to Helen first. Helen is the Senior Coordinator for COVID-19 Response at Swedish International Development Agency, and she'll be talking to us about applying the effective development cooperation principles in the pandemic. So Helen, thank you for your patience, and you have the floor.
Thank you very much. I hope you can hear me now. Yeah.
Yes, we hear you.
Okay, thank you. So thank you for the invitation to give a few words from our side. I'm speaking as a from a bilateral donor perspective, of course. And so many wise words have been said here, and also I feel very humbled by the first words from Dr. Ryan that we all got an F, as in failed, on the leave no one behind the agenda. Nevertheless, also my intervention is on a rather wide, as you can see, and it's not easy to cover all of that in 10 minutes, but I will give a go at it. So just to say that before my current position, I worked several years in Congo-Kinshasa at Swedish Embassy as Head of Development Cooperation. So I just wanted to start with sharing a few insights from when I worked there, and particularly as regards to Ebola outbreak in the Eastern DRC, and what I learned, and many others, I think. And for example, how difficult it was with outreach in regions with ongoing armed conflicts and already low trust between people, communities, and public institutions. This all made the response even more difficult and required a lot of learning to eventually have a more adequate response. At some point, the response was perceived as too militarized, for example. I think the role of the civil society, including faith-based organization already working in the affected provinces, was of key importance for the trust building and to put also to put the Ebola outbreak in context with the many other challenges, such as already limited access to healthcare, leading to, for example, many children dying in malaria. So the latest large outbreak took more than almost two years until declared over. So I think there were a lot of lessons learned there that could also, and I know that WHO and many with them have also tried to make use of that in the current pandemic. On the preparedness, but also on the necessity of community-anchored response and early detection systems. So over to the pandemic. The Swedish International Development Corporation is directly or indirectly contributed to reducing the spread of the COVID-19. And we have, during 2020, took reprogram or reallocated about 6% of our total disbursements. And that's amount to about 180 million US dollars. With the pandemic, we can clearly see the importance of international development cooperation and that ODA is kept at a high level. And of course, as Sweden, we are very proud also to say that Sweden's total ODA is keeping at the same level as before the pandemic. We know that for some donors, that is not the case. But we hope and think that this enables us, in combination with many other financial resources, not the least the domestic and local, to have a better response and to continue to reach the most vulnerable. So to say that our support has basically been along three lines: health response, the humanitarian response, and the socioeconomic response. One important measure that we took mid of last year was also to put we call them COVID tax on our contributions. That enables us to actually measure and see what support we are giving. The statistical system through OECD DAC, of course, previously did not have anything such as that. So we all see that countries are affected by the pandemic very differently and with rapid changes, something which calls for flexibility, learning, and adaptability for SIDA, I think also in general for donors and for the partners. We can note that since the start of the pandemic, we have had a very vibrant and active dialogue with our partners, and this has been of essence for the change. We could not have done this alone. It is together with the partners that the response has been adapted to the specific needs in a country, region, or thematically. And most of this work has been done from our side by my colleagues working in the respective partner countries. We have also, from the outset, we also said that the response needs to be done with long-term development perspective, have a focus on aid effectiveness and results, ensure that partner countries themselves set their own priorities, that partnership should be inclusive, and that there is openness and mutual accountability. Sweden and SIDA already had a large proportion of its support as core or program support, primarily via multilateral organizations such as UNICEF, the World Bank, and UNFPA. And this enabled them to take early action and continuously adapt to the needs in the specific context. to stay close to the needs in the partner country. This approach, as we see it, is of course part of the aid effectiveness agenda and existed even before the pandemic. Also working with the Team Europe approach during the pandemic and strengthening that approach has also strengthened the joint coordination in the respective partner countries, together also with the UN and the multilateral development banks. So I would say basically our approach has been keeping to, but also reinforcing the principles already set for Swedish international development cooperation before the pandemic. Leaving no one behind is at the core of SIDA's vision, and during the pandemic, this has, for example, translated to increased support to social safety systems in partner countries, such as in Sudan, and included new target groups or increased amounts transferred to individuals and households. The purpose has been to improve access to health, access to food and schooling, and ability to deal with unemployment, and a broader and a longer term sense, improve resiliences to crisis. A downside, of course, on that is that in many countries, these systems are financed with ODA and not sufficiently from domestic sources. Now over a little bit to civil society. So SIDA supports civil societies, often channeled through our Swedish strategic partner organization. There are 16 such, for example, Save the Children and Plan International Sweden. They, in their turn, work with some 2,000 local or national civil society organizations. So this is how we reach out. They work to strengthen civil society in partner countries to contribute to poverty reduction. So what happened during the pandemic for the SPOs, and particularly the local and national SCOs supported? SIDA early recognized the need to continue supporting civil society, to support civil society in its own right, and maybe there became even more so as restrictive measures were put in place in many countries. The lead word in discussion with SPOs were flexibility and adaptability, and we also focused on lessening the administration, both for ourselves, but particularly, of course, for the partners and the CSOs that they're supporting. So stay focused on the needs in the particular context, allow for reprogramming, but ensure aid effectiveness. Ensure that CSOs could continue to exist, even as, for example, agreed activities maybe were not able to be implemented or only partly, for example, due to lockdowns. So far, we can see that this has worked well. We are moving into the second year of the pandemic, and most likely further adjustments may be needed. The effective development cooperation principles have proven its value also during the pandemic. SIDA and our partners have tried to apply them. This is what we committed to well before the pandemic. Has it worked? Or to what extent has it worked? I think this webinar is a good input to that. But just to say that, of course, it will vary also from our perspective. SIDA has a bilateral cooperation in some 35 countries. In many of these, there are other challenges that are at least or even more prominent than the pandemic, such as ongoing armed conflicts. The crowding out effects of efforts to combat the spread of the pandemic, such as in the education and health sector, constantly needs to be on the agenda and discussed. So The CPDE recommendations in the report I think is a valuable input into adjusting the response for governments, but also for the donors. So of course we want to thank you for this. I will also share it with colleagues and continue the discussion on our side. So thank you for the opportunity to give a few highlights from our side and our approach. And just to finish off, to say that, you know, I learned just the other day that some 14,000 billion US dollars have been allocated as into economic stimulus packages due to the pandemic. Yeah, and it is said that about 1/10 of that amount is needed actually to attain and needed that's 1/10 of that amount is needed yearly to attain the Paris Agreement goal of capping the increase of temperature to 1.5 degrees. I think that's also something we need to take with us. It's enormous amounts that has been put into the economic stimulus packages, and we have another ongoing crisis as well. Thank you.
Thank you very much, Helen. That's been very, very informative. CETA has always been a leader in the development enterprise, and it's good to see that your government is maintaining the levels and that you're showing flexibility in the light of the pandemic. And I'm sure that many thousands of CSOs that you're supporting around the world have appreciated that. And indeed, your last comment is telling, as someone once said, if banks are too big not to start to fail, surely humanity is too big not to fail. That's not a very accurate quote, but I think it's putting those things in perspective when vast amounts of money are floating around. But thank you again, and thank you too to CETA for its ongoing support for CPDE. So we come to our last speaker, Monica Asuna, the Deputy Chief Economist at the National Treasury in Kenya, has joined us. Monica, you're very welcome. We know Monica well from her work with the task team on enabling environment for civil society. And Monica is going to talk about the response at the country level in terms of a country ownership of the response from a Kenyan perspective. So Monica, the floor is yours. Karibu.
Asante, Justine. Good evening, good morning, wherever you are. I'm happy to join and thank you so much for the invitation. Yes, as you've been told, I'm Monica Asuna, and I'll just give a brief on what the government has done in terms of responding to the pandemic, the COVID-19 pandemic. I must say that first of all, the effectiveness principles in terms of country ownership is very important and critical in terms of the fight for this pandemic, because you know, you need somehow somebody to lead the process, somebody to guide that what should we do, and then it's the government to take the lead, because the citizens will follow what the government says. So for Kenya, there has been a lot that has happened in terms of first of all, at the start globally, before the first case was reported in Kenya, there was a travel ban on international flights. So some flights towards the end of February 2020 that were coming into Kenya were stopped. And that was a bold step by the government so that there was no spread. The first case was reported in Kenya on March 13th, 2020. And from there, the government started monitoring how the spread was going to be. So measures were put in place to curb the spread. And towards the end of March 2020, there was the announcement of some ban on international travel, also closure of schools. Schools were closed because it was a threat now to our kids. Then Also, in terms of mitigating, the government did also some tax, measures. So on 24th March 2020, the central bank announced the measures to lower the cash reserve ratio, which was to 4.25%, and also lowering of the central bank rate. And this was just to at least make it easy for the citizens and also to cushion businesses. So the central bank rate was lowered from 8.25% to 7.25%. And towards also the end of that, there were curfews that were imposed by the government, by the president. There was the dusk to dawn curfew across the country. And also in terms of cushioning, the citizens now, there was also some stimulus packages that were, that were implemented by the government. And these provided the tax relief measures. So that the income tax was reduced from 30% to 25%. And also there was an increase in the personal, relief tax, which always those in formal employment enjoy. Also, there was a call for recruitment of increased number of health workers to just support, the healthcare system, which was at that time, very, very critical for the fight of the pandemic. There was also cash transfers to the vulnerable, that is the elderly, and also those who had lost their jobs. Also, the government also established the COVID-19 emergency fund response, where there was a call from everyone, the private sector and the public, to support the fund. So a lot of money was raised from that fund, and most of it went to social assistance. That is food relief, and also those who were heavily affected. And that was done looking at the 2019 population census, which showed those who were really living, below the poverty line. So those are the ones who are most targeted. So also the value added tax was also reduced from 16% to 14%. And also banks and financial institutions was also advised to extend a moratorium to those who are having credit, and also agree on the restructuring of those personal debts so that people do not default, and at the same time they're able to they are able to repay their loans without too much stress, taking into account that a majority were affected and lost their jobs. So in terms of our partners, in April and May, there was also a call for most of our partners to support the government in terms of the healthcare equipment, and also supporting in terms of fight of this. So most partners led by the World Bank, the African Development Bank, Germany, France, all those, and bilateral partners, I can't mention them all, responded to that call. So what did the government do? Because, everyone, globally, everyone was affected. So it was a challenge to really get, new funding. So being that at that time there were containment measures, most of the programs were not going to be implemented. So what the government did is renegotiated some of these ongoing externally financed programs, which now some resources were reallocating to the fight of the pandemic. And in that way, we were able to, raise about 34 billion towards the end of June 2020, just for the fight for COVID. And this was approved by Parliament just before it was, before it could be spent. Also, what the government did, maybe on that note, I may just mention that the challenge that we have is that there's a a structured way of dialogue with the private sector. There's a structured way of dialogue with our development partners, but we don't have a structured way of communication to the civil society. This is something which is in progress already. As Kenya in 2018, we hosted the first pilot under the task team on CSO development effectiveness. And one of the key outcome of that meeting is that Kenya to develop a CSO partnership framework. So we have a draft, and very soon we are going to subject it to stakeholder participation so that we finalize. So we hope that once we have this, there will be a very coordinated way of government, having dialogue with the civil society. So in terms of support, from the civil society to government, that was not properly streamlined, but there were a few that also channeled the resources through that emergency response fund that was created by the government. But also some responded as individual civil societies in the communities where they work, and they provided water, they provided sanitizers, and also sensitized the communities on how they should, take care of themselves to avoid being, infected by the virus. Just also towards in June, because our financial year ends 30th June, also what the government did is that there was stronger government leadership, and an 8-point stimulus package was drafted and agreed on. And currently also the government has come up with those 8 points, their economic recovery strategy. So there's an economic recovery strategy in responding to the COVID, and we've seen our partners now aligning their support to those strategies that the government has developed. So in that line, we also see the effectiveness, the effective development cooperation principles in play in terms of alignment and ownership. Then Nairobi, at one point, there was a total lockdown of Nairobi and Mombasa. So in July, there was partial reopening. Most eateries, restaurants were affected. And Kenya also experienced the second wave in August of 2020. And again, the curfew hours was extended. There was no lockdown of the country, but then measures were just streamlined. Right now, we are experiencing a third wave, and there are 5 counties. That is, the counties in Kenya is the subnational governments, because we have 47 subnational governments. So there are 5 subnational governments which surround Nairobi, which have been locked. So the Nairobi and the 4 counties which are surrounding Nairobi are under lockdown at the moment. And you cannot travel outside the 5 counties, but you can travel within the 5 counties. So that has also brought in another, financial and economic strain on the government, because this was done because this third wave is more, it's more harsh than the first and second wave. And so in terms of containment, that is what the government needs to do. But in terms of, social assistance, programs, that has not been implemented. There are so many who have lost their jobs now, especially in the transport sector, in the hospitality sector, and also tourism is highly affected because there was starting to be a peak of that. And so we are seeing that based on this, there's still a need for more, inclusive partnerships on how to address this. So January this year, the government reversed, because now we were seeing that at least the economy is trying to recover. We were, in terms of the infection rates were going down. So January of 2021, the tax measures which people got a relief were reversed. So there's instead of paying income tax of 25, we are now paying 30%. And some of the rebates which were also done, and these ones were to spur production in terms of locally manufactured face masks, locally manufactured sanitizer so that we could have mass production. Also, some of those rebates have been reversed, but at least the prices of the face masks and sanitizers have gone down from the start of the pandemic. They are now more affordable, and that is good. Also, what the government has done is also we've started also the vaccination program, and there's the 20% of the population is being targeted up to June, and that will include the health workers, the teachers, and those who are aged 60 and above, 58 and above, that is the senior citizens. So those are the first being targeted in the first phase of the vaccination. Then a second phase of the vaccination.
Monica, I'm just wondering, can you begin to come to a conclusion? We're just a little bit over time now.
Yes,
Please.
I'm just in my last, I'm just finishing.
Yeah. Thank you.
So I can say that right now it's the vaccination, and what we are doing is mobilizing more resources for the vaccines, and we hope that maybe by end of the year, at least the target is vaccinating 60% of the population. So those are some of the measures the government has taken, and I must reiterate that the EDC principles have been relevant and have been applied in this pandemic. Yeah, thank you so much, and also thank you for the invitation. Yeah.
Thank you very much, Monica. I think this has been a very important input. Of course, they've all been important, but this was the first real voice from the South. And what strikes me is that in terms of country ownership, when the pandemic broke out, there was kind of a great sense of worry amongst the northern countries that this is hitting us so badly. How will the southern countries cope? And yet, in his opening remarks, Dr. Ryan pointed out that health services in the northern countries collapsed within weeks. And I think we underestimated the capacity of countries in the South to deal with this pandemic with their own experiences, as Helen spoke about earlier in Kinshasa, and what was learned from previous pandemics. In fact, the reverse almost happened, and I think there was a lot to learn from how many southern countries have coped with this. So that's, I think, very important, and thank you for making the time to come and address us on that. Now, we've come to the end of our speakers. We have a 5-minute video, which is to be the official launch of the report. And it's great to see that we still have nearly 100 people here. And I think it's a tribute to the quality of the presentations and to your own commitment and that we're still here. I would just in case people are going to slip away before the video starts, I just to say a big thank you to all of the panelists for your contributions. They really were top class, and I think it has helped to for us to profile our report in this context is a great boost for us as well. And it's good to see that so many are also thinking along similar lines and doing similar exercises on evaluations and so on. And it's good that we can all work together. And as the Istanbul principles say, create knowledge and share it between us. I think that is the most important of all. So we'll move now to the launch of the report, and this I think is going to be way of a CPD video not to be missed. Our team made very interesting videos, lively and entertaining. So I hope Meg, if you're on duty there now, if you could roll the video as we launch officially the CPD report.
CPDE is proud to bring you the global synthesis of its study titled World in Lockdown, Develop
Well, thank you very much. I think that was very concise, and there's a lot of, it shows the meat that's in this report, that we have 9 recommendations of that nature to ponder. So we encourage you to go to our website, you can download the report, and also we would like you to make comments on this webinar and to give us some feedback on that. So I think finally to thank the technical team who put all of this together. I am terrified doing this kind of thing because I don't know one end of my laptop from the other, but when I have all this guidance and all the efficiency that's gone into setting this up, it's gone very smoothly, and thanks to all of those who have been behind the success of the presentations. And finally, once again, to everybody for staying so long, for being prepared to listen to those most interesting and challenging presentations. And we hope that this time next year, we will be in learning mode, having finally cracked this with the help of vaccinations, although it will take some time to get them out there, but we will be in a much more constructive environment to deal with COVID-19 and all those other threats that will emerge, as Dr. Ryan spoke to us of early on. So on that, I'd say goodbye and thank you.
Bye. Thanks, Justin. Thank you. Bye, and thanks, everyone.
Thank you, everyone.
CPDE is proud to bring you the global synthesis of its study titled World in Lockdown, Development on Hold, a special CPDE report on the ineffectiveness of the COVID-19 response. Amid the COVID-19 crisis, CPDE mobilizes members around the world to conduct research on the pandemic response through the lens of effective development cooperation. Presenting the synthesis of CPDE's global multi-stakeholder research. Here are 9 main points from our research. The reliance of developing economies on a market-oriented and market-led global economic system has affected their domestic capacities to overcome social and economic shocks due to COVID-19. Structural deficiencies, particularly debt servicing, compound the uneven or even weak implementation of COVID-related social protection measures in developing economies. While several governments provided support to those whose incomes were affected by the pandemic, these were temporary, limited in scope, and largely excluded workers in the informal economy. Of the 96 million people projected to suffer from extreme poverty following the pandemic, 47 million are women and girls. Many states have used the pandemic to attack human rights and civil liberties, such as the freedoms of movement, association, and organization. Some countries have tended to rationalize excessive police force in lieu of rolling out comprehensive medical solutions as a primary response to the pandemic. Attacks on democratic rights and spaces limit systems and mechanisms for promoting effective development cooperation principles in the pandemic response and undermined the position of civil society organizations as development partners and independent actors in their own right. Aside from being a public health crisis, COVID-19 is also an international development crisis, with severe implications on attaining development objectives and international cooperation. Despite the pandemic's challenges and the shrinking of civic space, CSOs have continued to engage in advocacy work, helping create alternative development plans, especially for the marginalized, to leave no one behind. We thank the following organizations for their participation in this research. To learn more about our COVID-19 initiatives, visit this page.